I'm Matt. I'm a radiographer with Ramsay Diagnostics. I work with a fleet of mobile MRI and CT scanners. So we offer a full range of MRI scanning from routine knees, lumbar spines to more complex work like abdominal work. We've also got a fleet of CT scanners, which again can look at your basic extremity work, musculoskeletal, neuro work, and we can go through to the oncology, the cancer staging. So again, we've got a full range of services available. Okay, so when a patient's got something wrong with them, I think one of the key points is they want to know what's wrong, and they want to know what's wrong quickly so it can be dealt with. This is where Ramsay are very good because we've got self-funding options. People can use their insurance. They can get quick access to the scan with no wait times and a quick turnaround of results so they can get the action needed to move forward.
I'm Clare House, Head of Diagnostics for Ramsay Healthcare. Diagnostics for patients is the first touch point for all of our patients, and actually diagnostics touches pretty much 80-90% of all patient pathways. So the diagnostics is the first point where a patient can have their diagnosis and then go on for their further treatment. So diagnostics is key critical for all patients. Ramsay Diagnostics have really been keen to involve patients within the full patient pathways, and we've recently commissioned a piece of work with the Patient Association and got some really rich data in terms of what's important for those patients. And as a result of that, we've started to secure our own patient advocates, and we're starting to create a patient advocacy group purely for the diagnostics services. So that's something that's in train and something that we're really keen to get patient feedback to actually develop our service in line with the needs of the patients.
Patient feedback is critical in any service. We need to know what we're doing right so we can carry on doing what we're doing right. But if things aren't right, again, we need to know so we can improve and make sure we're constantly evolving our service to meet the needs of the patients. I've got a good team to work with. That makes all the difference in this job. We've got a good team of radiographers at Ramsay.
My name is Elisha Matutu. I'm a senior CT and MRI radiographer at Ramsay Healthcare. We are all trained to try and make the patient feel comfortable. We explain every single step of the examination. We take them into the room, show them what's going to happen, maybe even do a test run to show them where they're meant to be in the scanner and see how they feel. We also give them a buzzer so they feel in control, because with that buzzer, anytime they feel uncomfortable or unwell, they squeeze it and we stop the scan and we're right in there with them. So
what makes a good radiographer? I think you need to have experienced things. I am an MRI radiographer. I'm a very claustrophobic person myself, so I can empathise with patients. I know what it's like to go in there. You need to treat every patient as if they might be a member of your family, because a member of your family is going to need a scan at some point. So if every patient that comes to you could be a potential family member, you will look after them and you will make sure that they get the best possible scans they can.
The patient journey involves them turning up at the hospital. They will report to the reception. In turn, the reception will let the scanner know, usually by phone call, that our patient is there. Then one of us will walk up to the reception, meet the patient, introduce ourselves. We then walk them up to the scanner where we go through their paperwork. Once that has been done, you can just explain the procedure to the patient, and then you get them ready for the scan, prep them up.
Once the scan is finished, we would then make sure they've got all the details on how to get the results. It's just as important as doing the scan is to make sure the patient knows how to get the results at the end of it. The images will be sent over to the hospital that we're scanning at. They will then get reported by a consultant radiologist over there. Reporting times vary from site to site, but the site that we're going to would let us know how long it's going to be. Normally within a week to 10 days, absolute maximum. The patient should have heard from the referrer with how to get the results. MRI scan, people find that bringing some music helps. We can play radio, but if they can bring their own sort of preferred music, again, we can play that during the scan. On the scanner, we have obviously got a patient changing area if they do need to get changed for the scan. We've got lockers that they keep all their valuables in. If they do lock anything away, we then give them the key to take into the scan room so they can be assured that their belongings are safe while they're on the scanner. If somebody does need somebody to come with them, they can bring them along to the scan. The only proviso would be that they are safe to go into the scan room as well. So MRI, the magnet kind of fills the whole room, so anyone entering the room has to be safety screened. So the patient, and if they want to bring a partner, somebody with them to sort of stand by them, they can do. So we find with MRI, people are nervous. A lot of this is historical. MRI scanners used to be a lot more claustrophobic than they are now. I've been doing this for 25 years. Scanners used to be a lot longer. They were a daunting experience. Most important thing to tell patients is not listen to what everyone else says about it. Judge it for yourself on the day. We've got lighting facilities on the scanner now. We've got LED lights on the ceiling, so there's a bit of scenery with all the wall art. There's an aircon, there's a cooling fan coming through. So scanners have got a lot more patient-friendly over the years.
So when people come to the mobile unit, there is a bit of a myth that, we don't have access for wheelchairs or trolleys, and actually we absolutely do. So the mobile scanners come with a lift, and the lift takes them straight into the control room if it's the MR, or into the actual scan room for CT. The diagnostics team is just an amazing team. They really do go over and above, and they will really try and support any patients with any kind of need that they have.